My topic is about the AMD type 1, type 2 OCTA-based management and treatment. Regarding the classification of CNV, we have to remember the Young and Freud American Journal the organization of type 1 CNV are localized below the RPE, while type 2 are localized above the RPE, and we have the type 3 that are origin in intraretinal spaces, and type 4 that are mixed like type 1 and type 2. By the use of OCTA angiography, new entities are appearing actually, like a filament-like neovascularization, particularly evident in pachychoroid disorder, the form of non-exudative CNV, even myopic CNV have particular aspects that are typical in OCTA angiography, and sometimes we can distinguish the residual flow in fibrosis. This is a typical aspect of CNV type 1, where the CNV is localized below the RPE. The shape is very irregular, and commonly the avascular zone are not involved. In this case, we can see the type 2 neovascularization that are localized above the RPE with the smaller shape, and sometimes has very heterogeneous shape. The type 3 neovascularization has origin into the retina and move to the RPE and choroid. And generally, this is the type of neovascularization type 3 that we can see at the starting of his evolution. The type 4 neovascularization is combination between type 1 neovascularization and type 2. Like we can see here, both color that are type 1 that are localized here, and type 2 that are more present during the examination of these cases. This is a typical aspect of filament-like neovascularization in CSI patients that are generally with the normally large sites, with the few loops all around the neovascularization. And this form that is named non-exudative AMD CNV is evident in the OCTA angiography, the neovascularization here in yellow, but if you've observed and studied the cross-B scan, it is impossible to see the activation in B scan, and generally this is quite a neovascularization. Our group has been interested in OCTA angiography evaluation after anti-VEGF injection since 2014, and we developed and studied some patients for a long time. Like in these cases, we can see here in the red star, the treatment for patient, and we can see the cyclical reactivation of CNV after the injection that generally reopen all around in the same place. Here we can observe the effect of anti-VEGF after 24 hours post-injection. We can observe the decrease of dimension of CNV activity with the reduction of small vessels all around. After 10 days, we can see and define well the feeder vessel all around the CNV that generally reappeared in the same position after the start of the activity of the injection, and after new injection, the vessels are newly decreased in dimension like the decrease of CNV. Here there is a time lapse in where we compare the OCTA angiography evolution during the follow-up of patients that are always comparable in cross-B scan here, and even the flow density analysis that sometimes give us important references during the follow-up in our patients. OCT angiography and cross-sectional are always be compared with each other, and sometimes, like in these cases, we have a good correspondences between these two images. We can see here in your left the activity of OCT angiography and correspective B scan, in which is possible to see the activity of OCT of the CNV even in B scan. After the injection, the reduction of vascularization dimension of CNV are very observable, well observable in comparing to the other B scan during the follow-up, and the reduction of subretinal fluid is well defined here. So we have a good correspondence here from OCT angiography and cross-sectional. This is another case in which the CNV activity are not well evident correspondence between OCT angiography and cross B scan, like in these cases. Here, between OCT angiography in one step and 1 week after, we can see a reopened of the new vessel that show a bigger flow inside. If we compare the B scan here, we can see a big and corresponding increase of activity. Here, where the anastomosis and the arcade of small capillaries grow in time, here is corresponding to a few activity here in B scan with subretinal fluid increasing. The recurrency of CNV after treatment are generally cyclic, so open and reopen over the time. And generally, there are some main branches that are less affected by the treatment, and probably this changes from the complex pattern and the less complex pattern as common to all the new vessels, and are called from spade vessel maturation. In the follow-up of over patient over 3 years, we observe some point that is important to reveal, and so that the CNV vascular area slow increase during 2 years. That the most important effect of CNV areas reduction are observable in the first or 2 or 3 injection in this patient. That the CNV vascular area returns to no treat level after 6 months, and the CNV vascular area after 2 years treatment is constantly bigger than when naive. In this presentation, is possible to see the type 2 CNV area trend in 34 months. We can observe the reduction and increase of CNV area over the time corresponding to the anti-VEGF treatment. Like here in type 1 neovascularization over 32 months, where reappear always the increasing of CNV area over the time after the reduction of effect of anti-VEGF. So in conclusion, we can see that CNV activity decrease is possible to see decreasing of CNV activity just after 24 hours post injection. That the maximum effect that we can see is after 6 days, between 6 and 12 days after injection. That the reopens of CNV generally is cyclic and became after 35 days after the injection. The OCT angiography allows to very close follow-up during CNV treatment, and the OCT angiography is able to predict the CNV activity recurrency also 2 weeks before the structural change in the B scan. Obviously, there is some exception in this evolution after the treatment, like in patient no responder, but usually the curve is quiet. Thank you for your attention. Professor Lombroso would like to invite all of you at next 5th International Congress in OCT Angiography, where 200 international speakers are invited. Thank you.